So in this segment, we're going to be talking about the NHS facing a exodus of doctors after COVID pandemic, a survey finds. So this is terrifying because after the pandemic, there's a huge backlog of surgeries and things like that that have to be done once the pandemic goes away. So during the summer, you'll start seeing, I think, more routine operations happen, and we have to hope that there's not another surge in COVID cases, especially from the India variant, because if that does happen, there'll be a further backlog of huge, cases, appointments, and all that stuff, regular checks that are going to have to happen. And the government have promised to put in more money, but it's not going to be enough because it won't deal with the main problems that we have within the NHS. So thousands of UK doctors are planning to quit the NHS after the COVID pandemic because they're exhausted by their workloads and worried about their mental health, a survey has revealed. These are people underpaid, overworked, understaffed, and constantly, abused in a way by the government, treated like rubbish by the government. The NHS should be the pride of this country, that we have a health service that looks after you free at the point of service. If I go to a doctor, I don't have to pay unless I need a prescription, which is ridiculous. But, if I break my leg in an accident or whatever, I can get taken to the hospital, they're not going to charge me anything. In other countries, they'll charge you, or in some countries, you'll have to pay to see a GP and they'll reimburse you. I don't have to worry about that in this country, which is great. The vast majority of people don't, which is, it's phenomenal, because I'm glad I don't have to worry about medical bills. But as the budget cuts keep taking their place and staff burn out, waiting times are going to increase because of the nature of the fact that there aren't enough staff to look after people right now. There's a lack of, a massive amount of EU staff have left already, which is something I've covered. I think 1 in 10 workers in the NHS are from the EU, so it's 10% of the workforce, and a lot of that's gone. So you got to imagine that these will be predominantly maybe British or English British citizens who potentially will leave the NHS, and that's scary. But we'll go back into the article. Almost 1 in 3 may retire early, while a quarter are considering taking a career break, and a fifth are weighing up quitting the health service to do something else. So the ones who retire early will probably be people in the higher paid roles like surgeons and stuff like that. Because it's just crazy, man. What's happening here is insane. Taking a career break, they're that burnt out that they can't do it. They can't keep going like this. And a fifth are weighing up quitting the health service to do something else. People who have gone to university, got an experience to do their job, be it whatever, a nurse or whatever role they have, and they're going to leave. They're going to leave because they can't do it anymore. These are people, the best of us in this country. They're going to leave because we've treated them like rubbish, and this pandemic has only made the situation worse. Long hours, high demand for care, the impact of the pandemic, and unpleasant working environments are taking their toll on medics. The British Medical Association findings show in a survey 5,521 doctors, 1,352 of the 4,258 who replied to a question about whether the career plans have changed over the last 12 months, said they were now more likely to retire early than they were last year, more than double the 14% who said the same in June. So this number's gone up dramatically. They have a fairly decent-ish sample size as well, so it's scary stuff. Maybe after the pandemic they'll reconsider, but things will not calm down after the pandemic because of the amount of routine operations and things like that are going to happen. So, this pandemic, once it ends, it will end for the general public, all the lockdown and stuff, but, the stress of the job will continue. The only difference is these healthcare workers will, won't have to fear COVID, but they will still have stress, they will still be burnt out, and they'll still have mental health issues because of what they've seen during the pandemic. So, some of these healthcare workers will have PTSD from being surrounded by death constantly in the ICU rooms, intensive care units. Those were healthcare workers who had to decide who lived and who died at that point. You can imagine how daunting that is for healthcare workers whose jobs it is to save the lives of everyone in this country. Smaller proportions were more likely to take a career break. That's 25%, a quarter. Leave the NHS for an alternative career, 21%. Work in another country, 17%. So that's going to be great for other English-speaking countries, predominantly who countries like Australia, who are constantly poaching NHS staff from England. They're going to get great out of this because you're going to go to a country where potentially you're going to be paid more and do less hours. That's the dream. or become a locum. So a locum is temporary staff. So a locum is a person who temporarily fulfills the duties of another. So they'll work as temporary staff. Some respondents selected more than one option. In addition, half said they were more likely to reduce their hours. And that's going to have a cost on the NHS, because by reducing the hours, it means getting care is going to be more difficult. It's going to be more time consuming. But I don't blame the NHS for all of these things. I blame the government. I blame David Cameron, Theresa May, and Boris Johnson for these things. Dr. Chand Nagpal, the leader of the BMA, said the high numbers of disillusioned doctors could worsen the NHS staffing problem and leave patients waiting for longer treatment. It's a constant negative spiral, and there are people who believe that this is done by design. That the Noam Chomsky idea of to privatize public services, all you do is just run them down to the ground, and then they'll people push for privatization themselves because they think it will be better. And that's what it feels like they've been doing with the NHS by chopping off parts of it and privatising areas. It's just ridiculous, that this country has let the NHS be ground down like this, and people just don't care. It's deeply worrying that more and more doctors are considering leaving the NHS because of the pressure of the pandemic. Talented, experienced professionals who the NHS needs more than ever to pull this country out of a once-in-a-generation health crisis, Nagpal said. And the government saying, "Oh, we'll give you a 1% pay rise," you shouldn't have bothered then, because that's not enough. Especially given that they haven't had a proper pay rise in 10 years, a real above inflation pay rise. One acute specialist doctor told the BMA, "My usual finish time is around 2 hours after I'm rostered to leave. I spend the rest of my days catching up on the rest of the emails I don't have time to deal with at work. It's exhausting." So you have people who are working potentially at home or in the office after they've done their normal day, because they don't have the staff to deal with all the emails and things like that they're getting. This is madness, and we don't even know if this could be 2 hours unpaid as well, most likely, by the looks of things. This person here saying that they've started exploring other career options outside of the NHS. They don't know yet if they'll leave clinical medicine, but they're considering it, and that's another talented person leaving who is going to be very hard to replace, because it takes years to reach that position. It takes years of studying and a certain talent level to reach that position. So again, we're going to lose talented and skilled people. This is ridiculous. It's a tough thing to consider. I love the NHS, this person says, but I know I can't keep this pace up indefinitely. That their own mental and physical health needs need to become a priority at some point. You can't let yourself get burnt into the ground. It's not good for you. It's not good for anyone. So the simple point is that these people need help. They need more staff, and they need a pay rise, and they need to do less hours. That's what they need to help them. And the simple fact is, if we keep voting in Conservative Party governments, is this going to keep happening? Asked what factors have influenced their thinking, doctors cited workload 45%, personal well-being 43%, pay 29%, working condition 22%, and the culture in their workplace. I don't think the government could change the culture in the workplace, but they could do more to lessen the workload by hiring, by finally training more doctors. Yes, it's going to take time, but at least there's something. Personal well-being, maybe the government could hire more, therapists and things like that to help people with their mental health. Pay, give them a goddamn pay rise. Working conditions, again, it'll probably fall similar into workload and things like that. So it's ridiculous. A GP in Yorkshire said, in my more than 20 years of training and working in the NHS, I've been the closest to leaving that job I love in the last few months. GP for 20 years has had enough. Like most, I've had days where I wanted to stop. I've had colleagues in tears, some scared of what's happening around us, and some completely overwhelmed with the avalanche of work that has hit the general practice, because they don't have the staff that they need. There are a massive GP shortage in this country. There aren't enough doctor surgeries. I see that in my own town, and if you live in England, most likely you see that in your town too. And people blame immigrants for the fact that they can't get GPs appointments. Nah, it's because there's a massive lack of GPs in this country. That's why. You can make the argument by having less immigrants, that's going to help you get a GP appointment. But, some of these people are GPs. Some of these people are healthcare officials. And if they leave, it's going to make it more difficult. it's just painful. An exodus of doctors would make it harder for the NHS in England to tackle the backlog of care. The waiting list for the hospital treatment already stands at 4.7 million, the highest it's ever been. And the government's answer to that is to start funding a bit more money to give the NHS to help it go through the backlog. But the problem is, you need more staff to help get through the backlog, and staff, to become a healthcare official, it takes many years in this country. Even if you just want to be a nurse, it takes time to train to be a nurse, and even then you'll be band 5. On the lower band, it takes time to get that experience to get to the higher bands. So the government's answer of just throwing a bit more money at the NHS isn't going to work. It needs a fundamental rethink about how many staff are recruited to be trained for the NHS. How many doctors are you training per year? That needs to increase. Things like that. Not to get in people who don't have the talent to be a doctor, but to try and increase that talent pool to make it a more valued job, to actually respect them properly. Nagpal said more than half of doctors are afraid of an unmanageable workload to try to deal with the backlog of millions of patients who are waiting for treatment, and most of them do not feel their hospital or department will be able to cope with demand. They haven't been able to cope. Hospitals haven't been able to cope. We know that for a fact. 3 out of 5 doctors are worried about the impact of the backlog on patient care. I'm not surprised, because there is a huge backlog of cases in for GPs and in hospitals, and how are they supposed to deal with that, especially when you get new people who are ill, new people who have accidents and stuff like that? How do you deal with all of it? Especially since the best kind of care is preventative care. If you have an issue, say if you find a lump or whatever, if you go to the hospital straight away to get it checked, it's far better than if you have to wait a long period of time, because if it is cancer, it could get worse, and it means you have to go through more aggressive forms of treatment, which are more costly, less effective, and also more likely to not work, more likely to kill the patient, because the patient couldn't get the care they needed originally, not because the NHS is at fault, but because the government hasn't given the NHS the funding it's needed over the last 10 years to deal with this pandemic and the backlog from this pandemic. That's the main problem. It's at the government's doorstep. A Department of Health and Social Care spokesman said there are a record number of doctors and staff in the NHS, over 1.18 million, and there are now more medical students in training than at any point in NHS history. They say this, right? They talk about the net number of nurses and stuff like that. This is the UK's population. This is at 65 million. Let's see, what year are we in now? The population is 66.7 million, right? It doesn't matter how many more you train, it's about proportions, about how many GPs you have compared to the population of a town or city. And we know that populations in towns and cities have gone up dramatically over the last however many years, and the number of GPs and the number of nurses, the number of healthcare workers has not gone up proportionally, and that's where you get massive problems. If you have, even if you train an extra 10 GPs or whatever, if the population's gone up by a few thousand, it's not going to cut it. That's the main problem, especially in the UK, where we have a massive aging population. You need a lot more healthcare, because as you get older, more things start breaking down in your body, whether that's physically or mentally. You're going to have more and more problems as you age out, especially in a country that's really cold and has a diet that's not great. That's what's going to happen. So the government's argument here is just stupid. We are backing the NHS with an extra 7 billion for healthcare and services this year. Is that all that money going to the NHS? Because previously, from what I've seen, the budget actually gave the NHS a cut for this year. So is this money going to the NHS really? Bring our total COVID-19 investment to 92 billion, including 1 billion to support the NHS by tackling the waiting list. But if you cover that, by however many hospitals and GPs and things like that there are, that £1 billion is going to be nothing. It's going to be very little compared to what they need. Is that going to help get in more staff? Probably not. So it's not going to deal with the fundamental issues. I've read somewhere that the government are going to use this to pay for more mobile machines and stuff like that. Cool. Who's gonna? It says it here actually there, in the bottom of this article. Surveys by medical groups show persistent and often widespread staff shortages in significant areas, which can lead to patients waiting longer than they should for diagnostic tests and treatments, including cancer care, heart operations, and other surgery. These are things typically where if you can get them checked early, they can deal with the issues. Maybe some of these things can be dealt with through dietary changes. Things like cancer, if you get it checked early, you can get it dealt with far earlier. You can get better treatments early on to deal with the cancer than you can later on. Once it hits stage 3 or 4. That's what we should be doing in this country. We should be looking at preventative care, being proactive, not reactive. That's the problem right now. Too many people in this country are reactive. not proactive. For example, it says here, a survey last week by the Royal College of Radiologists showed that a shortage of radiologists who can analyse scans is delaying care, including cancer treatment. So it doesn't matter if you buy a load more, machines that can detect cancer and things like that. If you don't have the radiologists to actually use these machines, it's kind of pointless, because a machine is great, but if you don't have someone to operate the machine, it's not going to do anything. So I don't know how many years it takes to become a radiologist, but I'm guessing it takes more than a year or 2 years, right? So, it doesn't matter if the government throws £1 billion at the NHS. The main problem the NHS has is staffing. You don't fix staffing by throwing a bit of money at it. It takes a long time of kind of a massive restructuring and investment when it comes to recruitment at the lowest levels and also at the higher levels as well. You have to start training more doctors year in. You have to start training more nurses. You have to start training more radiologists and people like this in order to deal with the problems the NHS has. But the problem is now, it's too late. It's too late now, because it takes years to train for these positions, and the NHS doesn't have years to fix these issues. It's got maybe two years to deal with this backlog. And that backlog is going to keep adding up because there are going to be more and more people with other issues. So yeah, I've rambled on for a long time. Let me know what you think in the comments below. Like, comment, share, subscribe, and if you genuinely care about the NHS and you vote Tory, you're an idiot.